Good afternoon, everyone. My name is Kelsey Heindel, and I'm a program coordinator in the MCW Office of Community Engagement. And welcome to the October edition of our monthly Community Engagement Spotlight Series. Please note that this session is being recorded. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please be sure you are muted throughout the presentation today, and we encourage everyone to use the chat bar freely to share comments or pose questions for our guests. We will be monitoring your questions throughout the session, so feel free to send them as they come to you. This monthly series features community partners and the important work they are doing for and with the community. We highlight their goals, motivations, and accomplishments in the ways they have partnered with people and programs at MCW. Today, we are deeply honored to have Sarah Bassing-Sutton from the Northeast Wisconsin Mental Health Connection joining us as our featured guest. At this time, I would like to introduce our program director, Sarah O'Connor, who will say a few words about the Northeast Wisconsin Mental Health Connection's important work for the community. Sarah?
Thank you, Kelsey. I'm pleased to introduce you all to Ms. Bassing-Sutton and the Northeast Wisconsin Mental Health Connection. The mission of the connection is to lead a coalition of diverse stakeholders who champion mental health for everyone in the Fox Valley by addressing barriers, challenging systems, creating solutions, and prioritizing care and support. The connection was born out of the findings from the LIFE study, a Theta Care Plunge, and a mental health summit in 2011. The community was further motivated by a cluster of teen suicides that took the Fox Valley and have been working collaboratively since then to move the needle on large-scale, systemic, and complex issues of mental health. The connection has now expanded to more than 80 members across the Tri-County region, with new members joining every month. Member agencies include Theta Care, Ascension, Children's Hospital of Wisconsin, and community-based agencies like NAMI, Fox Valley, Apricity, the Sexual Assault Crisis Center, and Pillars. Other members include school districts, municipalities, law enforcement agencies, faith communities, individual community members, and mental health providers. Thank you, Ms. Bassing-Sutton, for being our featured spotlight guest today. I would now like to introduce today's facilitator, Dr. Sarah Kolbeck. Dr. Kolbeck is the director of the Division of Suicide Research and Healing in the Comprehensive Injury Center at the Medical College of Wisconsin and assistant professor in the Department of Psychiatry and Behavioral Medicine. He conducts research that focuses on better understanding suicide among disproportionately affected populations, including farmers, veterans, and youth of color, to facilitate the development of appropriate prevention strategies. Dr. Kolbeck, thank you for serving as our facilitator today. I now turn it over to you.
Thank you so much, Sarah, and thanks to the folks in the Office of Community Engagement, for the opportunity to spotlight a really wonderful organization and wonderful person that I've been working with for the past several years. And I'm really excited for the conversation that we're going to have today. I do just, before we start today, just want to note that the project that we will be talking about today is a project that's focused on suicide and suicide prevention. And that can be a tender topic for folks. And so if, at any point today, you feel like, maybe you need to step away, anything like that, most important just to care for yourself in the space. And just a gentle reminder after today's presentation to try and do something nice for yourself in the name of self-care. So Just wanted to provide that quick content reminder. So again, I'm really excited and privileged to spotlight and talk with my colleague and friend, Sarah Bassing-Sutton. And so I'm going to just start out with a basic question for you, Sarah. If you could just tell us a little bit about yourself and the work that you do with Northeast Wisconsin Mental Health Connection.
Yeah, absolutely. Recovering from the technology glitch, it's only great when it works, right? And even after all these years, we still have those glitches. Anyway, so yeah, the work that I do with the Connection is focused on adult suicide prevention through the Project Zero Everyone Matters work, which is the funded project through AHW. And like I said, Project Zero's goal is to reduce adult suicides in the Tri-County. So we have a footprint focused on Outagamie, Winnebago, and Calumet counties. And the work that we do is systems level work. So we don't do any direct service. The work that we do is really sit at that 30,000 foot view and monitor how the system is working and do the research to identify innovations that can help the system to work better and really make a difference in the lives of many rather than the lives of each individual.
That's great. And I think that systems change work is so important. And I think as we'll get into a little bit more as we talk today, systems change is really difficult and time consuming in many cases. But I think we've learned a lot through the work of Project Zero over the past several years, actually. So suicide prevention and suicide is a difficult health space to work in. And so I'm just curious, what brought you to the work of suicide prevention? What got you started in this field?
That's an interesting question. As was mentioned in the introduction, there was a cluster of suicides in one of our high schools locally that happened about 10 or 12 years ago. And I was working for a counseling agency at that point, and was a part of the Connection back then. And the group was discussing interventions for intervene or to interrupt that contagion that was happening among the high school students. And one of those programs was an adolescent suicide screening program. And at that time, it really spoke to me. I had kids that were close to that age and really enjoy the work of developing and implementing new programs. So when that opportunity presented itself, I decided to give it a shot. And that was really the entry for me into doing direct suicide prevention work. And I had no idea that I would like it as much as I do.
That's great. I think a lot of us that work in this space have a personal connection to the work, whether it's, through our own lived experience or maybe the lived experience of somebody that we care about. As you mentioned, having, kids in a community where youth suicide is, sort of, appearing as part of the community, it really kind of speaks to some of those personal connections. And I think that passion for the work, one of the things I say about suicide prevention work is that you really have to love this work. It's challenging work. And I think, like you alluded to, a lot of us that come to this work do it for reasons that, connect us directly and personally to that work. So thank you for sharing that. And yeah,
I think the other piece of it too, for me, Sarah, is really the mystery of it. Suicide can seem like such a mystery on the other end of it. And decoding, if you will, or identifying factors and solving the mystery of what happens in a person's life that leads to that, I think is the other piece for me. And as a community, what we can do, what are the factors, what are the pieces that we individually and collectively can be responsible for to prevent suicides is the other part of this work that is continually motivating to me, because I think we all have a piece and there is a mystery to be solved and a way to improve things. So, yeah.
Yeah. We say often that suicide is complex. And sometimes I think that that word complex can be used as not an excuse, but it can be used as, something that we say, to convey that there are a lot of factors, intersectional factors that often play into a suicide death. But I think sometimes we put the word complex there so that we don't have to spend the time doing that research and that kind of solving that you're talking about, really kind of disentangling these different factors and stressors that, are common across these losses of life. And I really think, the work of Project Zero has contributed to that kind of disentangling of these different factors that we see. And one of the things that, so I want to talk about Project Zero and about the work of Project Zero, but I think one of the things in particular that is an activity of Project Zero is the Adult Suicide Review Team that was initiated under the project in Winnebago County. And I'm wondering if you can maybe talk to the group a little bit about the work of that team and really how that contributes to kind of the overall goals of Project Zero.
Yeah, the Adult Suicide Death Review is a gathering of multidisciplinary partners who all have a stake in suicide, either directly a service provider when someone dies by suicide. So that could be law enforcement, EMS. It could be a healthcare system who perhaps served that individual prior to their death. It could be schools, it could be churches, a wide variety of partners who are impacted by suicide. And we come together to review the facts of an individual's life leading up to their death and really identifying what are known risk factors that lead to suicide, as well as identifying trends over time with other suicides that happen in this area. So by doing that, we're able to identify the gaps in the system and where folks are falling through, as well as identifying triggers or trends that tend to perhaps point us in the direction where more attention is needed and more intervention is needed. And that work really will inform the system of how interventions need to occur so that we can reduce suicides. The other work of Project Zero is really helping healthcare systems to adopt or consider the idea of the zero suicide framework, which is a really lofty aspirational goal of continuous improvement, if you will, and working toward zero suicide, understanding and agreeing that no suicide is acceptable and one is too many. So I think that the Adult Suicide Death Review really helps to inform the systems in a variety of ways based on the factors of any given individual who dies by suicide.
Yeah. So you mentioned, the other component of Project Zero, which is the zero suicide approach that is a healthcare system quality improvement, continuous quality improvement approach. And so throughout the work of Project Zero, how has having an academic partner contributed to the progress of the project?
The project wouldn't make progress if I didn't have my academic partner. And I mean that very seriously. I get to, because of having an academic partner, I get to engage in the community. I get to go out and talk with our community partners and learn from them what's not working. I get to find out where there are mission alignments for systems level change. And through having the ability to go out and do that work, it allows us then to innovatively develop interventions that might change the system so that the system functions differently and folks aren't falling through the system. So, you know, a few of the logos that were on the screen prior to us starting were the CCR team, which is one of those projects that came about because of Project Zero. And the amount of data that is collected for just that one pilot is enormous. And if there wasn't the Sarah academic partner analyzing all of that data, we would be missing so much. We would not have any indication of how successful that program is. We wouldn't understand changes that need to be made. We wouldn't know who is being served. We wouldn't know how they're being served or what the outcomes are or the trends in what work is happening by the CCR team. And truly, the connection is focused on data-driven decision-making. And so if we didn't have an academic partner who knew how to look at all those numbers and make the pretty pictures that speak all the words, we would be really missing out on so much opportunity to identify both ways of intervening in the system, as well as the progress that we're making through the work that we're doing.
That's great. It's really good to hear.
This is the best job that I've ever had because I get to do the work that I love and I have an academic partner who can analyze the numbers. And I've grown to love the numbers, but I could not do with the numbers what you do with the numbers. So I'm so grateful for that. So that leads me to a question for you, Sarah. What have you learned through our partnership that has helped you to become a more effective academic partner? Because you partner not only with just my project, but a number of other projects and have for quite some time, I think.
Yeah, that's a really good question. I think one of the things that I love particularly about our project is, and here I'm coming back to that personal connection again. I have family that lives up in the Fox Valley region, so this gives me an opportunity to feel like I'm contributing to a project that is promoting the health of people that I love in my life. And so I think doing the work of an academic partner has opened up opportunities for me that I might not necessarily have. I think that sometimes when we're working at an academic institution, our space for work is kind of sometimes confined to, the immediate community around where I'm working and living, which is absolutely fine. And at the same time, working as an academic partner on Project Zero, in addition to some other projects, has definitely opened up opportunities for me to work with folks across the state, which has then, provided new opportunities and new partnerships and new networks. One of the things that we've managed to do together because of Project Zero was to develop a statewide community of practice for suicide review. We have a suicide review team in Milwaukee County. Y'all have one in Winnebago County. And really, you and I and others were able to work together to bring this community of practice together of, I believe, 15 other suicide review teams across the state who are all doing similar work to really learn from each other. We put together that really great suicide review guidebook. And I think really benefiting from the lessons of others in that space. And that wouldn't have happened without this partnership through Project Zero. And the realization that, there are others out there that are doing this work. They might have been doing it longer. They might have things that we can learn from, and we might have information that we can provide back to them. And so now we've all written another grant together to try and build and sustain the work of suicide review in Wisconsin. So I think one of the things that I've learned is that this type of partnership is is such a great way to really get my hands dirty with work that's going on across the state. Around a topic that I'm passionate about. And it's really been a very fulfilling endeavor for me in that way. In terms of becoming a more effective academic partner, I think that sitting in a lot of the meetings that we have, particularly with our community co-responder team, with representatives from different sectors of the community, from law enforcement to county crisis to county health and human services to the sheriff's department to the new mental health connection, is really understanding the mechanics and the sometimes minutia of systems change. It takes a lot of discussion and going back and forth and looking at MOUs and asking questions and pulling data, and being an academic partner. Without that experience, I don't know that I would fully understand that the way that I think it should be understood, is that there's a whole heck of a lot of work that goes into systems change. And I think that helps me be more effective going forward into other projects as well, is that there's that nuanced, on the ground, very, very practical understanding of the work that needs to be done to make this kind of change occur.
Yeah, it's a lot of minutia, like you said, and the systems change really does take time and patience and continued conversations and allaying fears and really understanding and hearing where partners are stuck. And I find it beneficial too, with you as the academic partner being here, that the folks in our community know who you are and they trust you and the work that you do. And that has been so beneficial because it has opened the door for data sharing that I think is tricky. And so I think that is a wonderful benefit of having an academic partner, is having access to data that we probably wouldn't without having the institution behind us. Mm-hmm. So with an academic career, how do you balance that work with this community engagement work?
That's such a great question. And I think it's something that folks working in an academic space who really have the drive and desire to work in partnership with community, it's something that to grapple with quite a bit. I think that institutions, academic institutions, funding partners have started to understand the benefit of community engaged work, and are valuing it in a way that maybe it hasn't always been valued in the past. I think MCW is certainly a leader in that space. So that does make that balance a little bit easier, because there is that space and that value that's placed on this work. But obviously, as being a researcher, there are expectations for writing grant funding proposals and papers and presentations, things like that. And I think one thing that we've managed to do really successfully is get our work out there. And, this really helps with, from an academic career, that's what you want to do, right? You want to get the work out there. You want to get it published. You want to present on it. And you have been, we have taken our show on the road, and we have presented at a number of conferences. And I think, and I hope that has been a valuable experience for you, because it has certainly been a valuable experience for me. And, so I think, taking the time to have those conversations about, what my expectations are in my career, what the needs of the community are, and figuring out how we can best balance all of that, while of course prioritizing the work of the community, has really worked well in this project. funny when I'll email you and say, hey, I submitted an abstract, it got accepted, do you want to come present with me? And you inevitably say yes. And then we get to go and present on our data and our findings and meet people from across the country who are doing this type of work. So yeah, I mean, it's definitely a tricky balance, but I think in this project we've really managed to demonstrate the value of the community work as well as the research and the data that's gone into the project, and have done a good job of co-producing the different research products that we would call as part of the work that we do together.
Yeah, I would agree with you wholeheartedly, and I love when we get to take our show on the road. Because I feel like the work that we're doing is important, and every little piece of research and progress in suicide prevention needs to be shared. And I think that when we're out there doing that work, as well as the work that we do directly in the community, it lets funders know too the work that is happening and the progress that is happening, and that it is possible to make systems change like that. And the other thing that I think has probably really benefited our project and our partnership is the fact that the Connection is a collective impact backbone agency. So if we were an organization that provided services or direct service or programming, like a traditional nonprofit, I don't know that I would be able to do all of the taking the show on the road that we get to do together, because I would be tied much more to facilitating a program. And so I think that is really a unique piece of our partnership, is that part of my work really is to get the word out there, and part of my work really is to help be the content area expert and share the information. And that I think is the benefit of the way that this project is set up, in having somebody seeing the system from a 30,000 foot view, is that it's important to go out and share it, as well as learn from others who are doing this work too. So,
yeah. I hadn't thought of that, about the kind of the benefit of the Connection as the primary community partner, really, for this, for the implementation of the work of Project Zero, and how that might look different. Like our relationship might look different if the agency dynamics were a little bit different. And so I think there's definitely benefits that we've been able to see because of the way the Connection is structured. And I think also with the reputation's not the right word, but maybe the clout that the Connection has in the community, and has really worked to develop over the last, I think we said 2011, so the last 12 years, really. I mean, I think that speaks to the notion that this community engaged work takes a lot of time. It takes a lot of time to develop those relationships. It takes time to build that trust. And I've certainly felt that as a community partner. There's definitely, or an academic partner, I'm sorry, there's definitely been times when I have sat in meetings, wondering if people wonder why I'm there. Like, who is she and why is she here? And she's from the Medical College of Wisconsin in Milwaukee. Like, what is she doing up here? And it has taken time to, I think, demonstrate what I can bring and how I can help. That has helped kind of build that trust. But it's taken a little bit of time. So,
yeah, absolutely. And I mean, I think that's a really good point, because, the credibility of the Connection and the trust that has been built over time, it's almost as if like the stars have aligned, because the truth is, we've been talking about this stuff for a really long time, this concept of no wrong door. where when folks are trying to enter the mental health system of care, that they should be able to access it no matter where they go first. And, the project, the Mental Health Navigator project that has come out of Project Zero is a prime example of kind of the stars aligning, because our community has been talking about something along these lines forever. And, because of the trust, because of the credibility, because of taking the time to engage and to be here, I think, has allowed for things to come to fruition and for the data to really be able to tell that story, because people are willing to share it.
So I want to shift gears a little bit, and I want to talk about COVID. It sounds like such a fun thing to talk about on Wednesday afternoon. But Project Zero was awarded in 2022, and you and I first met
in 2020.
In 2020. Yes.
Oh,
January of 2020. Sorry. Thank you.
Yeah.
I remember you and I met at a strategic planning retreat that January, and we sat down to plan out Project Zero based on the approved, implementation plan for our project. And we had a beautiful plan. It was based on, a data strategy and a community strategy and a healthcare strategy and a workforce strategy. And we were going to do all of this wonderful work and programming and evaluate it and have a wonderful systems change 3 years. And then COVID happened, and we had to completely recalibrate the work of Project Zero. So I'd like for us to just talk a little bit about that and reflect on that process of what that was like. So from your perspective, what impact did COVID really have on the work of Project Zero?
Yeah, well, we wouldn't be here having a hybrid meeting probably if it weren't for COVID, right? So here we are. So the impact of COVID on Project Zero. So like you said, I was 3 months into my job with this wonderful work plan that you and Beth, my executive director, had created with all of these wonderful plans. And what I think is really amazing in looking back is that I think we have met all of the things that we said we were going to meet in our work plan, despite COVID. However, they did not look anything like we thought they would look. The work was not what we thought it would be. When I think about one of our data strategies being surveillance data on adult mental health, we had grand plans and ideas of going out with iPads and asking community people to respond to a survey on an iPad, and not an option. Not an option when COVID hit. The work of helping folks feel more comfortable with help-seeking behavior. How do you interact with folks when you're all on a screen, or when you can't actually go see people face to face? And so, the creation of the Strong Minds for Men website, which is a resource tailored to men for men, was the way that we kind of pivoted to find a direction of increasing help-seeking behavior in a high-risk population that was completely feasible when we were all online. The other thing that I think, COVID, so much to say about it. Project Zero probably couldn't have come about at a better time, quite honestly, as we all felt the impact of the physical health pandemic we were in, and then that wave of mental health problems that everyone was experiencing that really leveled the playing field for all of us, because I think mental health became a much easier topic for everyone because everyone was struggling. And so, you know, in that way, I think that, again, the stars were kind of aligned for Project Zero. And the work that we ended up pivoting to was really the work of monitoring the mental health of our community, which I don't think that any of us ever thought we were going to be doing. You know, we ended up recognizing that folks were struggling with being at home and not being able to see loved ones. And police were probably getting more phone calls about welfare checks and people who were not doing well. And so it opened up this door for us to partner with law enforcement in a way that we never had, to be able to get ahead of that wave, if you will, of people who are struggling, so that we could give that data that we were able to collect and that you analyzed back to our community to really say, here's what's happening with adults in our community. Here's what people are struggling with. We were able to really get a grasp on what was happening and create some programming and some pilots that never probably would have come to fruition under the original work plan for Project Zero, but have really made huge impacts in our community. You know, the CCR team is one of them, and that has reduced the number of emergency detentions in our community immensely. And that was because of COVID. So,
right.
Yeah.
Yeah, one of the things that I think about, so we quickly pivoted and started to collect information on those law enforcement calls for mental health. You know, welfare checks, calls for suicidal ideation and suicide attempt. We started collecting that information, and what we were finding as we were collecting that data with our law enforcement partners, again, this was something we had not proposed as part of Project Zero. Gathering that data, we were able to really see, okay, there are a lot of intersectional stressors that are happening in our community. And then one of the coolest things that I think we've done in the project was we gathered together a group that we called the Dream Team, which was a group of individuals from around the community, including folks with lived experience, folks working with the LGBTQ community, you know, mental health providers and others. And we called the group the Dream Team because their job was, based on this data that we're seeing about the mental health and mental illness in the community, what would be the dream ideal system response to these mental health issues that we're seeing in the community. And having that opportunity to pause and say, this is what's happening. If we had no restrictions on funding, no restrictions on time, what would we do? And then starting with that ideal system response, figuring out how we could sort of insert and inject different aspects of that ideal system response into existing systems in the community. And that's really where the systems change that we're seeing started. That never would have happened if we hadn't, not to say that Project Zero wouldn't have been totally awesome as it had been proposed, but, you know, we were talking about implementing the zero suicide framework in our healthcare systems, and our healthcare system partners were like, we can't do anything. We're dealing with COVID. Our public health partners were saying, we can't do anything. We're dealing with COVID. But we were able to work with law enforcement. We were able to work with, you know, folks with lived experience and mental health service providers to think about and be creative with other ways to sort of, we're not going to change the whole system today or tomorrow, but what are these little things that we can start infusing and injecting into the system that is going to eventually lead to larger systems change that will hopefully lead to better mental health outcomes in the community. And really that was the genesis of the CCRT, or the Community Co-Responder Team. Do you want to just explain a little bit about what that project is?
Sure. So the CCRT is mental health professional from Outagamie County Crisis that is embedded in our local law enforcement. So the city of Appleton was willing and ready to partner with the county crisis to have a co-response to mental health calls. And so that systems change has been going on for the last 2-3 years. And the outcomes that they have seen through having a co-response have been so great that the county has decided that they want to expand this way of approaching mental health crisis throughout the entire county of Outagamie. So it has been pretty phenomenal to see how these two very large systems who are very different and function very differently come together because of a shared goal and wanting to help the lives of the community members to figure out how to do this work together at the same time. And I think what they would really say is that they may have thought that this was just going to be doing crisis work in a different building, and it's really doing a whole different job. And I think that that has been some of the learning of the work of the community partners that have engaged with these opportunities that we've been able to open up, if you will. And so, yeah, the co-responder team has been immensely beneficial to our community, such that, you know, it's expanding and I think will continue to based on the outcomes.
Yeah.
Yeah.
Well, we're coming up to 10-2. And so I just want to wrap up with a couple of, I guess, kind of summary questions. So in thinking about not just Project Zero, but kind of the work of suicide prevention as a whole, what are some things that folks can do, or how can folks support the work of suicide prevention? Even if they're not even working in this space. Yeah,
that's a huge question, and a good question, because having done this work now for quite a while, I truly and firmly believe that suicide prevention is everyone's work. It is not the work of mental health providers. It is the work of all of us, because truly folks are killing themselves because life has become painful in so many aspects and so many ways that they can't see any other way for that pain to end, and it becomes a tunnel vision. And so if we are all working toward creating a world and a life where everyone wants to stay and everyone feels valued and everyone feels like they belong, we are truly doing the work of suicide prevention. And that can be as simple as being aware of your language, using proper pronouns. It can be saying hi to somebody. It can be taking a QPR training and learning how to ask that question of, are you thinking about hurting yourself? Are you thinking about suicide? And helping somebody get connected to emergency care if that's what they need. But most of the time, what folks need is really just somebody to listen, someone to be present, and to hold space. Because the truth is, we're all dealing with a lot. And we can make life easier for one another just by being present, just by working toward having a space where everybody wants to stay. Yeah.
I always think, and this might sound really corny or cheesy, I don't know, but this is what you said about, people really needing somebody to just listen, is that one of the things that I've come to realize is that I think the heart of suicide prevention is love and caring. It's not, necessarily romantic love. It's, showing, caring and compassion and love for other people. And I think that extends to our policies, right? Like trying to extend that love and that caring into the policies that we implement and that we create. Like you said, to make to make the world a little bit more livable for folks. Because, you know, and like you said, in many cases, it's kind of an untenable situation for folks. And so I think, you know, one of the things that I talk about when I do trainings is that I would love for everybody to become an expert noticer. Just noticing, you know, changes that you see in people on a day-to-day basis, noticing when somebody seems down, when they seem like they're not themselves, noticing, and then being willing to step into a space where you can ask how they are doing and be ready to have that conversation, and really what that involves is just being ready to listen. You don't have to have all the answers. You don't have to have specialized, you know, training to be able to listen in a way that's non-judgmental and is loving. And so I love that. I love the way that you put that.
Thank you. Yeah, it just makes me that whole concept of getting outside of ourselves, right? You know, we're all dealing with a lot, and if we can be expert noticers and get outside of ourselves and just have a presence with others when we are in their presence, yeah, that's pretty powerful.
So I want to open it up to folks who joined us today to see if there are any questions. I see Jessica put an invitation in the chat for thoughts and questions. You can certainly unmute if you'd like to and ask Sarah or myself any question that you'd like. You can put a question in the chat. So we'll just give it a minute. I have a problem with filling silence, so I'm just going to be quiet for a second. All right, so Sarah O'Connor popped a question in the chat. Oh, she just sent this to me. So, oh, these are good questions. So, Sarah, I'm wondering if you could talk about the large partnership that makes up the connection. Ooh, and how you all navigate and meet and make progress. So there are how many organizations that are part of the connection?
Yeah, so the connection is a collective impact backbone agency, and we have over 80 members. The collective impact that we focus on is around the work of mental health in the Tri-County area. So we focus on those wicked problems. We focus on those complex problems that no one agency can solve on their own. So when we're talking about suicide, that is not a problem that anyone is going to solve, any one agency. So those types of big systems problems or access or things like that are the work of the collective impact backbone agency of the connection. Organizations that want to become members pay a membership fee if they're able to, and they then have access to our member meetings, which happen every other month, the odd numbered months, from 7:30 to 8:30 a.m. And the connection itself employs one person. So my boss, the executive director, is the employee for the connection, and the connection does work that is so big. So we have adolescent suicide prevention arm. We have a Drive Health initiative, which is focused on our BIPOC community members' mental health and health equity. And the members come together because they know that there is value in focusing on the bigger picture, which is, you know, the suicide prevention, the access, the, you know, all of the things that affect everyone. And doing that work together breaks down the amount of work that there is to do. So that's kind of the big picture for what the connection is and how the member organizations work together. And it truly is organizations, when they're ready to do the work, engage in the work, and maybe they just come to meetings, but maybe they're ready to take a different step in their organization and they're ready to take on a project. And so, you know, if the time is right and they're ready, they may engage in a different way.
Yeah, That's such a great question. And I think one of the things that I've observed with the connection and the work is that you have decision makers at the table, people that can actually bring those ideas and suggestions back to their organizations and make the change, which is really, really important. So,
yeah.
So Lindsay has a question. What is the current law for someone who has been involuntarily hospitalized for suicidal ideation and attempts to have access to a firearm? I had a very dear friend die by suicide this summer with a firearm she purchased very quickly in Milwaukee. I'm just wondering if she should have even had access. That's a great question, Lindsay, and I'm so sorry for your loss. That's heartbreaking and a tragedy for sure. So, Sarah, I don't know if you have any thoughts on that question. It's a tough one.
That is a tough one, and thank you for sharing that and asking that question. I am not a legal expert by any stretch of the imagination, but my understanding, and Sarah, you might know more about this than I do, is that the only restriction to firearms is if you have a felony. Otherwise, unless somebody is on a commitment, I believe, with a county for mental health reasons, they are also then not, there may be parameters within that where there is limited access to firearms, but for someone to be on a commitment with a county doesn't happen very frequently. It happens pretty infrequently. So when someone has a suicide attempt, it does not mean that they would be on a commitment. And so they would have access to a firearm just like any of us would, unfortunately.
Yeah, I mean, so we hear about things like universal background checks. Most of the folks who attempt suicide with a firearm don't meet the criteria for preclusion of ownership. Like you mentioned, Sarah, having a felony or maybe a domestic violence record. Some of those preclusion criteria don't typically apply to people who die by suicide. And so some of the studies that we've done in recent years have looked at, what are the backgrounds of folks who die by suicide? And typically what we're seeing are folks that might have had an operating while intoxicated charge or two, but that would not preclude you. That would not put you on a list that would be flagged on a universal background check. And so obviously firearm policies differ state by state, but it sounds like Sarah said, having access would, be just like anybody else. Anything that you want to leave off with, Sarah, that I didn't already ask you?
I can't imagine. If you're curious about the connection, I think the website for the connection was put into the chat. Check us out. We actually have a mental health summit coming up for LGBTQ in November, which is super exciting. We're bringing in Alok, and those tickets are still on sale. If you're interested in coming to the Fox Valley and supporting LGBTQ suicide prevention and mental health, you can come and see Alok on November 4th. All that information is also on our website. But I can't say enough about how amazing the partnership has been in having an academic partner. If I could keep this in place for all time, I would. So that's my plug.
Thanks so much, Sarah. I really appreciate you, appreciate our partnership, and I want to figure out how we can keep working together forever because
Amen.
Yeah, it's been a really great experience. And so thanks, Team Sarah/Sarah. Excellent. Thanks, everybody. Yeah, I just want to say to folks who joined us today, thank you so much for taking the time to spend some time with us this afternoon. As you can see on the screen, there's a recording of the presentation that's going to be available. You can donate to the Northeast Wisconsin Mental Health Connection by scanning this QR code or learn more by doing that as well. And then the next spotlight session will be coming up on Wednesday, November 29th at 4. Stay tuned for that and who will be part of that spotlight conversation. And I wish everyone a wonderful Wednesday and a great rest of your week. Thank you so much.
Thank you.